Hey y'all, it's Kosta. On this channel, we explore the unavoidable truths and innovative solutions to the long-term care industry. In this video, we're talking about the main issue with long-term care. So the biggest problem facing long-term care is a supply and demand issue. But more importantly than that, it's the outcome from that supply and demand. So supply, meaning that we have a lack of staff or caregivers that are able to facilitate care, and demand, that we have an ever-growing amount of people that need access to long-term care. The outcome, what occurs, is that rising inflation, the cost of care continues to go up, and it is out of reach for the majority of Americans. In my opinion, I'd say probably 95% of Americans. So there are a handful of things that we can do to address this issue. The most important thing is we need to drive down the cost of care. If we could drive down the cost of care, then we wouldn't have to rely on federal and state programs to be the only and absolute payer of long-term care. People could actually pay for it out of pocket. But you have to understand that when you pay for care, you're paying for a human being. First thing you have to do is incorporate technology. You have to be able to remove some of the human element and incorporate some type of technology, whether it's remote surveillance, whether it's a more effective way to treat wounds, whether it's a more effective way to do diagnosis, telehealth, something that allows one medical professional to, instead of serve one or maybe two or three people at one time, but serve 100 people. That will then lower the cost of care. The second thing that we can do is we could raise taxes that in turn will allow us to be able to fund these programs better, which means that we could pay higher wages to caregivers. And that is a significant problem that I'm sure all of you are aware of. And then more people will enter that workspace and it will increase the supply of caregivers. So the third part is human capital. Guys, we can either take care of our own family members. We could lobby our elected officials to be able to provide some type of stipend for individuals to be able to stay at home and care for their loved ones and family members. Or we could talk about immigration reform. Either way, all three aspects are tangible solutions that can increase our supply of caregivers, that could help meet the demand and help lower the cost of care. 70% of people over the age of 65 are going to need long-term care. So it is an inevitability that either your family member or you yourself will need long-term care at some point. So we can't just keep sweeping this under the rug, right? That means it's so important that you get in touch with a long-term care insurance agent, or you start planning for what happens if you need long-term care or if one of your family members needs it. The most important thing that we can do is identify that this is something that we have to prepare for and start the conversation.